So we use many terms that mean the same thing when we talk about psychological disorders. Sometimes we use the word psychological disorder, otherwise known as mental disorders, mental illness, psychiatric disorders, we sometimes say. And these are all referring to a condition characterized by abnormal thoughts, feelings, or behaviors. One problem is that term abnormal. There's no universal definition of psychological normality or abnormality, right? So much hinges on what people consider to be normal or abnormal behaviors. So, for example, red hair occurs in only 1 to 2% of the human population. So, therefore, it could be considered abnormal. But just having red hair doesn't mean that you have a medical disorder. It's the same thing with mental disorders, right? That just because you experience a particular symptom, that alone is not enough for us to say that you have a disorder. And so we'll discuss that further in a little bit. When we think about mental disorders, we often talk about the mental health, mental illness continuum, that there's a spectrum ranging from mental health or mental wellness to mental illness or mental disorders. And that examining both sides of the spectrum is really important, as we discussed in last week's lectures or last week's or 2 weeks before that on positive psychology, examining mental health or the positive qualities of humanity that are important for well-being. And so on one side of the spectrum, on the left side of the spectrum, we have well-being, where we talk about people who have occasional stress or mild distress. Just because you are mentally healthy doesn't mean that you don't experience stress. Everyone experiences stress. What makes someone mentally healthy is their ability to cope with stress. And everyone has some difficulties or some stressors that are difficult to cope with. And so just because you are feeling stressed or experiencing some distress doesn't mean that you necessarily have a mental disorder. Some people are more in the middle. They have certain prominent emotional problems or concerns. They have some mild distress. And that's an important aspect as well. And then there's people on the far right who have diagnosable mental illnesses, psychological disorders that are often believed to be at least partially biological in nature, but likely a combination of psychological, biological, and social factors that contribute to mental illness. So, for example, when we talk about the textbook mentions school shootings or mass shooters, and how there's so much controversy about what we say about these individuals who commit these mass murders. You know, are they mentally disturbed? Should we screen for mental illness when we at the point of sale for firearms? And things like that. Should people who have diagnosable mental illnesses be not allowed to bear firearms? One issue with that line of thinking is that we know from many epidemiological studies that people who have diagnosable mental illnesses are often more likely to be the targets of violence rather than the perpetrators of violence. And so it's a gross overgeneralization to say that anyone with a mental illness should not be able to purchase a gun. That could potentially have so many harmful effects. On the flip side, another side to the argument is that just because someone doesn't have a diagnosable mental illness does not mean that they are mentally healthy, right? So the people that we see who commit these mass murders, they might not necessarily meet all the criteria for schizophrenia or bipolar disorder or antisocial personality disorder or any other disorder, but it doesn't mean that they're healthy. Those individuals likely don't have healthy social relationships, likely don't have a great ability to cope with stress or adversity. And those are things that are all part of mental health. So it's important for us to distinguish what we mean when we talk about being mentally healthy and someone having a diagnosable mental illness. It's not just um, it's not just a yes or no question. There's a long spectrum in the middle that needs to be talked about. One common framework that we use to describe a specific diagnosable psychological disorder are these three characteristics. That a psychological disorder will likely result in some personal distress. It will likely cause some violation of social norms, and will likely result in disability and or dysfunction in some way. So to talk about these in a little bit more detail, let's use the example of OCD, obsessive compulsive disorder. So there are two main signs of OCD. Those are obsessions and compulsions, and those refer to two different things. Obsessions refer to recurrent thoughts or urges that are intrusive or unwanted and cause some kind of distress. And the individual attempts to suppress those obsessions by performing compulsions, specific behaviors, repetitive behaviors that they feel driven to perform to neutralize an obsession and to neutralize those feelings of distress. So the obsessions are the thoughts and the compulsions are the behaviors. So for example, some people might have obsessions about being contaminated by bacteria or intrusive thoughts about someone breaking into their house at night. And so the resulting compulsion, the behavior would be engaging in really repetitive and rigid hand washing or repeatedly checking the door if it's not locked in the middle of the night. Other common compulsions might include cleaning or putting things in a specific order or counting things or other things that are similar. So when we think about OCD, for OCD to be a valid construct of a psychological disorder, we would look for how does this set of symptoms cause someone personal distress. So when we talk about personal distress, we're talking about a subjective feeling that is caused by this abnormal behavior. And so, for example, we see in OCD that these intrusive thoughts about being contaminated by bacteria lead someone to feel distressed, that they can subjectively say and will say to a therapist or a psychologist or a psychiatrist that these thoughts stress me out. Now, there are always some exceptions, right? So one exception is that not all psychological disorders cause personal distress. For example, many people who are diagnosed with personality disorders, they don't find it to be a problem for themselves. They view other people as a problem. People who have narcissistic personality disorder, everyone else is the problem. I'm not stressed about me. It's not personally stressful to me. It's everyone else who has the stress or everyone else who has the problem. Another exception is that not all behaviors that cause distress are because of a disorder or can be categorized as a disorder. So for example, if you are celebrating Ramadan and you are fasting and you feel desperately hungry, you're hangry, you're feeling distressed because of how hungry you are because of fasting, you don't have a psychological disorder. You're just hungry, right? So not everything that causes distress, obviously, is a disorder. Next, we talk about the violation of social norms. So when we look at OCD, all right, so it causes personal distress. Does it also meet the criteria of, does it violate some standard of behavior that is held in a particular culture? So for example, someone who washes their hands or let's say 20 to 30 times per day, that would be viewed as abnormal in North American culture. That would be viewed as excessive. So that would be violating a social norm and would meet that criteria. However, there are some major exceptions to this aspect of diagnosing psychological disorders. Not everyone who violates a social norm necessarily has a disorder. So for example, people who are convicted of a crime often have violated some kind of social norm, that it's not normal for people to steal from a bank, or it's not normal for people to murder someone. You could say that. But that does not necessarily mean that they absolutely must have a psychological disorder just because they committed a crime. Are they mentally healthy? That's another question. But do they have a diagnosable disorder? Not necessarily true. Also, not everyone who has a disorder violates social norms. So for example, there are certain jobs like being in academia or being in medical school that tend to attract highly anxious people, that most people who get to this high level of education tend to be kind of driven and kind of anxious people in general. And so people who are anxious in academia or medical school might fit in really well. In fact, someone who's calm, you might be the person who's violating the social norm. And so just because you are violating that social norm does not mean that you have a disorder. Also, social norms vary across time and across cultures. So across different cultures, there are different social norms. That goes without saying, particularly when you compare individualistic versus collectivistic cultures. Also, it varies across time, even within a culture. So here in North American society, hand washing has probably increased since the beginning of the pandemic. And that would be a normal, a culturally appropriate response to what's going on in the world. If you have an increase in hand washing behavior now, that doesn't mean that you have violated a social norm. The final aspect that we look for in categorizing mental disorders is disability and dysfunction. So we look to see if this set of abnormal behaviors, it causes you personal distress, it violates some kind of social norm, and does it result in some kind of real change, or some kind of real consequence in real life, such as in work or relationships or school, or some other way that you are being impaired because of this abnormal behavior. So, for example, I've dealt with clients who have had repetitive hand washing result in job loss, that they either had to leave a job or were fired from a job because their compulsions were not appropriate for that workplace. And so their abnormal behavior, not only did it cause them distress, not only was it unusual, but it resulted in some real life consequence. We also talk about dysfunction. When some biological or psychological system isn't working properly as a result of this abnormal behavior. So for example, if someone checks the door excessively before going to bed or in the middle of the night, and they just constantly feel like someone might be uh, breaking into their house, and that results in a lack of sleep, that would be an example of dysfunction or functional impairment, that something is wrong with that biological system. Uh, and the exception here is that not all psychological disorders result in some kind of real life disability. As we already mentioned before, you could be a highly anxious person. You could be diagnosed with an anxiety disorder, but that anxiety might actually be useful to you at your workplace, particularly if you work in a job that attracts anxious people.